Hello, Balance Mamas, and welcome to the Balance Mama Project Radio. You are here with Dr. Saiah. Hey.
Hello.
And you are also here with Dr. Val.
Hi, everyone.
And today we'll be talking about a topic that many ladies think about before giving birth. However, at least from the folks that have come into my office, people are not always feeling prepared for how to either reduce the risk or address some of the side effects and things that can come up afterwards. And so what shall we chat about today? It is perineal tearing. And so this is one of those topics, it might feel a little scary. In some cases, people might just be a little bit confused. And before we do the deep dive, just to locate the perineum. So we have the vagina, and then you have your rectum, so the anus area. It is that strip of tissue between those two structures.
And so to be clear, because I know that there is sometimes some confusion about what the vagina is. Sometimes we think of the whole
Like the
female
vulva.
the whole female reproductive external tissues as the vagina. But instead, medically, we term that as the vulva. And that is what includes like the labia, the lips of the vulva itself, but the vaginal opening that's what we're referring to as the vagina. That is where you would have penetrative intercourse. That is where the menstrual blood comes out, discharge, things like that. So just to be very clear about our terming and our terminology and what we're talking about today.
And that is where tiny one is coming out of when we talk about a vaginal birth. And so the truth is, tearing during birth is common, but what is not normal is dealing with, or I should say, struggling for months and for years with pain following that time period. And so pain with sex, pain with sitting, pain with toileting. That is not something that's going to be normal. We want the body to recover and the scar, like the tear, the scarring, to heal as anywhere else would heal in the body.
Yeah, exactly. And so the healing can happen on its own if it's a small tear. So the perineal tearing can really range from being small and being just kind of like a surface area, a surface level tear, to being quite large, extending from the vaginal opening all the way to the anus and kind of going deeper into muscle tissues as well. So that might, if you're leaning more towards that level of tearing, or that degree of tearing, I should say, then a lot of times you will have some stitches and things like that. The care is going to look different. And so what we do as PTs is help you to understand what degree of tearing was experienced, and also and this is on the back end, what degree of tearing was experienced, and what healing might be appropriate, what course of treatment might be appropriate for that healing process. And then on the front end, we also look into just explaining to you what the different types of degrees of tearing are, and ways to minimize the risk of tearing, because I want to be clear that yes, tearing can be common, but it is not always normal. So we just want to educate on some preparedness, some decreasing of the risks. And if you did experience tearing, which again is common, how to rehab those things.
And when Dr. Val mentioned the degrees of tearing, so typically we're looking at first degree to fourth degree, and the higher up the number, typically the more structures are affected. And so that's generally rated on, did we just have a little bit of tearing through the skin? Did we get into the muscle? How far into the muscle did we get through? And as you can imagine, when we talk about tearing that is now affecting the muscle group, so we are pelvic health physical therapists, and so we do love talking about the pelvic floor. When we're talking about the tearing of muscle, these are pelvic floor muscles that we are looking at. And so a lot of times in that rehab space, we'll get into rehabbing them in a moment, but if we are tearing through the muscles, then we have to look out for things like, yes, pain, but also then we start talking about urinary leakage. Stool leakage. Not to say this is something that must happen, but it is something to look out for because these muscles are key or very important in keeping urine in keeping stool in, and in letting it out when they're relaxing, just like when they relax and they're letting tiny one out. And then we're even talking about pain with sex. That same region, so if we're thinking about the vaginal opening, if we're trying to recover and that area is still healing, or has a little bit of extra scar tissue there, when we talk about penetrative sex or anything inserted into that region, that might also be painful and feel a little bit more scary. That on top of just being in that postpartum time period where we have a lot of hormonal changes and have a lot of vaginal tissue changes. And so yes, pain, leaks, those are going to be some of the main things to look out for.
Yeah, for sure.
Healing and function.
Yeah, absolutely.
Are going to be very important.
Absolutely. So, okay, so you might be thinking, what do I do? I'm pregnant, or I want to become pregnant, and I've heard horror stories about tearing, or even if you haven't, maybe you're just like, I really just would love to avoid that. Understandable.
Yes.
I myself was like, I want no tearing. And so I was trying to do all the things, right? And so what can you do before birth that would help? Because, you might be feeling like you are powerless in the situation, or you might be feeling like you, have to have a tear, and it's not true. You really don't. So 3 things that we do want to focus on are, preparing the tissues in that area. So perineal massage, and a lot of times we'll do this towards the end of pregnancy, like
34 weeks.
Yeah, 34 weeks, and then on to the end. And we teach both yourself as a birthing person, but also partners can help with this. Partners, caregivers, whomever is going to be your support person, they can help with preparing that tissue. So it's usually done with a specific technique that we teach in the clinic, to really make sure that you are bringing some blood flow into that area and allowing the tissues to find some gentle stretch, not so that you are stretching out that area, but so that that area remembers how to stretch when it's time during the birthing process. So anyway, it's going to help to get that memory into those tissues. And then we also think about, yeah, go ahead.
It also makes the stretch, at least theoretically, makes that stretching sensation less scary.
Yes.
So when you have practiced breathing, it's all about practicing breathing and stretching the tissues. It's like, oh, this is what stretching feels like. It's not like, oh my goodness, this is the first time I'm feeling it. Yeah. Ring of fire, everything's happening. No, it's like, all right, I can breathe. I know what it feels like to have this area stretch. It's not like a initial fight or flight sense kick on. Exactly.
It's getting that memory into those tissues. Like, right. Exactly. And then also something that we do too is help with some pelvic floor awareness. So, I'm going to put a disclaimer out there and say that if you are pregnant currently, I really hope you are not doing Kegels, okay?
Not 1,000 to prepare.
Yes, not 1,000 to prepare. There are ways that you can support your body, but we really want to focus on learning how to relax and lengthen the tissues, because that's the goal of the pelvic floor muscles during delivery. If you're birthing vaginally, those muscles just need to separate and get away and move.
Open and stretch. Get out the way.
Stretch. Exactly. So there should be no reason why they're tense, and we work through and talk with you about how to allow those muscles to relax and lengthen themselves.
There is a space during that pregnancy time period where if you were already leaking urine or something else was going on, you may be doing some pelvic floor strength training. And that is wonderful, but that is not you preparing to get tiny one out. The relaxation training that Dr. Val was mentioning is going to be super important. Hip opening, pelvic floor opening, getting that area used to moving, relaxing and stretching. Because essentially when you're doing the Kegel, you are squeezing and closing the region that we actually want to relax and open and let baby out of. So you are not you are not going to be Kegeling to practice getting baby out.
Yeah, and I think another thing too is we work on your ability to coordinate and be mindful of the muscles in that area, because sometimes, you might be not aware of what it feels like to actually relax those muscles, or maybe are unaware of the fact that you might be holding those muscles in a particular way and tightening those muscles. And so those are some of the things that we work on with you as pelvic floor PTs. Your personal pelvic floor PT would work with you on that.
Yes.
And then another thing that we do to prepare is again focus on those breathing and pushing techniques. So really teaching you great practices and methods for allowing those muscles to relax, like I said, allowing you to have not a ton of strain, and to properly push without holding your breath or without creating an unnecessary pressure dynamic in your body. So all of those things, because if you think about it, if there's pressure going against something that is very tight, that thing that's tight likely is going to rip or tear and not be ready for that pressure. And so we teach you how to properly pressure manage with breathing and pushing.
To that point, I always tell people, you are not pushing like you're pooping. A lot of times if people have not practiced beforehand or gone over it, I will hear feedback where it's like, oh, I was told to push like I'm pooping. And while theoretically, yes, bearing down is a similar motion, but you are not pushing the baby out of your rectum. And so typically we talk about the direction of push, because we don't want new hemorrhoids. We don't want old hemorrhoids coming back up. And so it's like the direction of push is important, just like the pressure managing and the breath during pushing is just as important. So yeah, making sure to ask questions. A lot of times it's better to know beforehand versus getting to the room and being confused. I've seen mommies, I just saw one on her third child, and she was like, yeah, so we can do the practice, because for my first 2 children, I really didn't know what I was doing. They were like, push. And I'm like, I'm doing it. And they're like, nothing's happening. And so, yes, there's mirror feedback. Yes, there's different types of feedback. But it's good to know before it's the higher pressure situation of trying to get tiny one out. So, yes, let's talk a little bit about postpartum. So, say you have had tiny and you had a... I hope that you don't. I'm not wishing this on anybody. But say that you have a perineal tear of sorts. A lot of times the general theme is going to be rest. So you may have some stitches down there. Rest. Don't lift anything. Come back in 6 weeks and things should be okay. Typically it is very tender. Down there, we do have a whole masterclass talking about immediate postpartum and even care to that perineal region. So please check it out.
And when we say immediate postpartum, we're talking from day 0 all the way through 6 weeks. So that in between time when you're told, like, come back in 6 weeks and we'll check you out. What do you do then? What is happening in those 6 weeks? So that's what we go over in that masterclass for sure.
Yeah, because those first few days, it can still be sore, painful, and you might need your ice, your witch hazel, all the other things. But there is a lot to be known about sitting without pain, how to urinate, how to defecate without pain. And so that is something you can go over in pelvic health PT as well. And just how to move safely and comfortably. Like, do we need an extra cushion? Do we need to form our cushion or our ice pack a certain way to make us comfortable? Because a lot of times it can be an intense time period overall. Yes, the body might be tense because of stress, but then the body can also tense up due to pain. And that just leads to more dysfunction and more pain. So even before the 6 week mark, know there are things to be done, positions to be gone over. Yeah. Breathing strategies, relaxation, and re-engaging strategies. The Kegels might pick back up, y'all. And truly, they're pelvic floor contractions. The Kegel title, they take me out every time.
I know. Every time. That's so true. Well, so when we think about what does rehab look like, your rehab, everyone's rehab is going to be different, but some might include like restoring that pelvic floor function. Like we said, those muscles have been stretched and have gotten out of the way so that you could deliver. But now it's about how can we coordinate those to work for you again when you're sitting, when you're standing, when you're moving, when you're doing all of the functional activities that you do. Then when it's time for the tissues to be repaired, looking at that scar tissue healing, making sure that we're addressing it so that it's not creating any limitations for you, it's not causing any pain for you, your body's not registering it as like this is a problem, I'm considering it to be painful, and then also rebuilding that core strength and support. So postpartum, whether you've birthed vaginally or via cesarean, it's still about that restoration of the core muscles. That's really key because it's going to help your whole body system work well and function well. So we just wanted to end on the fact that perineal tearing can be common, yes, and at the same time there are ways to reduce the risk ahead of time, and then there are specific ways that are necessary to rehab so that you are decreasing your likelihood of pain, you are allowing your tissues to move properly, and you're supporting your body. So yeah, do you have anything else you want to say, Dr. Saiah?
No, I like it. Give it time. Tissue healing takes time. It can even be up to 2 years. I'm not saying that should be how long the pain should be there. But yeah, 6 to 8 weeks is a good time to even start looking at the tissue healing. But no, support the bodies. See pelvic health therapy early. Once you're out of survival mode, mamas. I know sometimes people are just trying to make it through the days. Otherwise, stay balanced, mamas.
We'll see you soon. Bye.
Bye.